an excellent biomedical intervention for HIV prevention. We have not had a new intervention in a while. We have been using condoms, behavior change communication. However, PrEP, I think, can be a game changer for us in the HIV response in Jamaica. So PrEP would definitely have a significant impact on our HIV incidence in Jamaica. When you look at it at the individual level, persons who adhere to PrEP reduce their risk of HIV acquisition by about 99%. However, we have to look at adherence and coverage in terms of the population effect that we would want from PrEP. Studies have shown that amongst high-risk populations, if 40% coverage is there along with 40% adherence, you will have a 10% reduction in incidence. If that coverage and adherence is increased to 80%, then the reduction is about 45%. So we notice that that will have a significant impact on our epidemic. However, adherence and coverage of our populations are also key in achieving significant reduction. Well, I personally am taking it from the perspective of the 3 Ps. I think it has to be strongly promoted. It's something that persons also have to think about their personal risk. One of the things that we face in Jamaica is that the risk is everybody else's. It's never ours. So personal risk assessment is a key part of it. And thirdly, our providers or healthcare workers need to introduce persons who are at high risk for HIV acquisition to PrEP as well. It is certainly a key and important part of it. PrEP has to be very well implemented for it to work well. And as such, we have to ensure that we put the necessary structures in place because adherence and coverage are key components for PrEP to be the game changer that we require in our HIV response. The main thing I would say to persons who are thinking about getting onto PrEP is adherence. You must adhere to your medication. You must adhere to your medical appointments as well to ensure that the necessary testing is taking place. We have to remember that PrEP is a program, it's not a pill. And as such, other components, getting your regular HIV testing done every 3 months, use of condoms to reduce the spread of other sexually transmitted infections, getting your liver function test, your kidney function tests are all part of the program. PrEP, it's not a pill. Yes, there is some evidence to show that there is a reduction in condom use in the presence of PrEP. We have seen that in the literature within the Caribbean as well as in the US, where we have seen increase in syphilis rates among some populations. One of the things we have always noted as part of the HIV response is that the other STIs facilitate HIV transmission. Therefore, if you're not using condoms properly or consistently, and you're also not adhering to your medication for PrEP, then the risk of acquisition is high. This is Nicola Skyers reminding you to be prepared.